Hello and welcome. My name is Joe Furia, and I'm Executive Director of World Forestry Center, a nonprofit working at the intersection of people and forests for over 50 years. At World Forestry Center, we believe that how we manage forests impacts everyone, and that forest issues are fundamentally social issues. That's especially true of today's topic. More smoke is in our future, either due to catastrophic wildfire or the prescribed burning necessary to reduce the severity of those fires. And that smoke has public health impacts. For today's program, part one of a two-part series, we've brought together leading researchers to discuss what we know about the public health impacts of wildfire smoke, who is at risk, and what is needed to assess the full costs on society. This program will be moderated by World Forestry Center's Director of Experience, Tim Hickox. Hi, Tim.
Hey, Joe. Thanks for that warm welcome.
It looks like you got a great program here today.
Yeah, I'm really excited to be here.
What's sort of the larger context for what we're going to cover today?
We know that fire is a natural part of healthy forest, and that one of the biggest challenges that society is facing today is how we can learn to live with fire in a more balanced and healthy way. So, science tells us that we're probably going to live with these unnatural, large, and severe wildfires for quite some time. But science also tells us that there's actions that we can take to mitigate the threat of catastrophic fires, such as things like prescribed burning and mechanical thinning and others. And so the reason the World Forestry Center wanted to host this program today, specifically on the public health impacts of wildfire smoke, is because we see that as one of the most critical and timely issues in the wildfire conversation that's hopefully going to motivate people to act on opportunities that can improve the health of our communities and the health of our forest.
Well, I'm going to turn it over to you and to introduce our panelists and get the discussion underway.
As Joe mentioned, this is the first of a two-part program series on the public health impacts of wildfire smoke. We have 5 panelists today. I'm just going to give a really brief introduction to each of them and their role of where they work, and encourage the viewers to go to our website at worldforestrycenter.org to read their full bios, and there's also some links there with information on their current research. So with that, I'm going to do some intros. Our first is Shahnaz Hussain, a professor in public health sciences and associate director for population sciences at UC Davis Comprehensive Cancer Center. Thanks, Shahnaz, for being here. Michael Brower is a professor of the School of Population and Public Health at the University of British Columbia and is also a principal research scientist and affiliate professor at the University of Washington. Anna Rappold is a statistician and branch chief with the clinical research branch at the Center for Public Health and Environmental Assessment in the EPA's Office of Research and Development. Marshall Burke is the associate professor in the Doerr School of Sustainability and deputy director of the Center for Food Security and the Environment at Stanford University. And then last but not least, Tom Corringham, staff research economist at Scripps Institution of Oceanography in San Diego. So thank you all for being here. I just want to provide a little more of a brief introduction and just acknowledge that before we start this conversation, that wildfire is a natural part of healthy forest. And we know that although we're going to see large and catastrophic fires for quite some more time, science does show that we can take action on more sustainable forest management practices to mitigate the threat of these large and catastrophic fires. And that really one of the biggest challenges of our time is to find more of a balance on how people can live with fire on the landscape. So as science tells us, we have an opportunity to take action on these issues. I'm going to hand it off to Michael for our first question. And Michael, you've been studying this field of research, I think, about as long as anyone since the late 1990s. And I'd just like for you to provide us with an overview of how the impact of wildfire has grown both here in North America and across the globe? And what's been the evolution of its impact on human health?
Great, thanks for the question, Tim. I think we've seen over the last 20 to 30 years that wildfires used to be sort of extreme events that were relatively infrequent and sort of impacted mostly rural areas. Now they've become regular events of our summer seasons, and they also impact our major urban centers. So it's almost an annual occurrence that our large cities, certainly on the west coast of North America, but also elsewhere in the world, get impacted with episodes of wildfire smoke. So it's become much more frequent, much more intense, much more regular. At the same time, our understanding of the health impacts has also changed. When I first started this research, there was a real question about whether this smoke was even harmful. This is natural, it's wood. We've had fires for millions of years. And we've learned that first, that this smoke definitely has impacts on respiratory health. We're gathering more and more evidence that it has impacts on cardiovascular disease, so on the heart, and now increasingly on other organ systems, just as we know for urban air pollution or fossil fuel sort of combustion air pollution. So really, it seems like we're faced with this very severe threat that is going to worsen, that is producing very harmful exposures for large segments of the population. So it'd be great to get Marshall's thoughts also on this topic.
Thanks, Michael, and thanks, Tim, for the nice intro. Michael's been at this for since I was in high school, so it's really nice to be here with him, and really nice for our group to get to build on the sort of research he's really laid the foundation on for the last 2 decades. So that's been great. To emphasize what Michael said, it's just looking at data over the long run. It's really remarkable to see how quickly this has changed. As Michael said, both in terms of the wildfire activity, how much more burned area we've seen. Again, that's not always a great measure because, Tim, as you said at the top, we're actually going to need more fire on the ground, right? We've been putting them out for a long time. That's a big part of the problem, a century-long hole we've dug ourselves because we have suppressed fires and immediately put them out for the last century instead of letting them burn in a low-intensity way. I think this is a topic we'll come back to. But what that means is we have a century of fuel loading in our forests. These forests are rapidly drying with climate change, and so that's driven a really remarkable increase in fire activity and resulting wildfire smoke. So we've calculated in my group that just over the last decade alone, we have seen a dramatic increase in wildfires' contribution to overall pollution levels. So if we concentrate on particulate matter, the ultrafine particulate matter or fine particulate matter that gets deep down into your lungs, causes a lot of the negative health consequences that Michael just mentioned. We have seen, even 10 years ago on the West Coast, wildfire accounted for maybe 10% of total PM concentrations in populated centers. In recent years, the last few years, that number is up as high as 50% in some parts of the Western US. So again, 10-ish, 10 to 20%, all the way up to 50% in just a decade. So a remarkable increase. Even faster increase in the number of really extreme days we get from wildfire smoke. So we've seen tenfold, hundredfold increase in the number of people exposed to really, really bad days from wildfire smoke. Again, that's just in the last decade. So a remarkable increase in this exposure, and this is leading to a cascade of negative health consequences that Michael mentioned.
Marshall, I'm curious. It seems Stanford has been really at the forefront of studying the long term impacts of wildfire smoke. Is there been some really surprising things that have popped up in just the last 3 years? I mean, the wildfires of 2020 really strike me as a turning point. Would you say the same that's been true for the field of research on this topic?
I think that's right. A lot of us have come to this much more recently. Like I said, folks like Michael have been really working on it for a long time. But I think the dramatic increase in the wildfire activity has actually prompted a dramatic increase in the research effort devoted to understanding the drivers of this increase, the consequences, and what solutions we have at hand to deal with it. So I see that as a good thing. A lot of people are interested about it. It also reflects the challenge that we're facing and these dramatic changes that we've seen.
Great, thank you for that. Our next question, and I'm going to start with Tom, is a question that I get here in the Northwest quite often. Is is wildfire smoke really that different from smog or even breathing cigarettes? And to add to that, where do you all see this falling on the spectrum of other serious health issues? So, Tom, I know you just had a recent study that came out. Maybe you could share a little bit about that.
Sure, thanks, Tim. At Scripps, we recently conducted a study where we looked at the population level impacts of wildfire smoke, and in particular, the fine particulate matter that Marshall mentioned, this PM 2.5. It's smaller than 2.5 microns, so much smaller than the width of a human hair. And as Marshall said, it gets deep down into the lungs. And we looked at the impact of PM 2.5 from all sources, and then specifically at the impact of fine particulate matter from wildfire smoke. We studied all of Southern California for a period of 14 years, and we found that unit per unit, increases in wildfire particulate matter was up to 10 times more impactful than increases in other forms of air pollution. And this was in terms of hospitalizations for respiratory conditions. So I think we've been very successful at reducing air pollution in our cities, in Southern California, in the United States, and around the world. But we're seeing now this increase in pollution and smoke from wildfires, and that is not something that we've been able to reduce. And in fact, that's been increasing over time.
Great, Shadaz, I think you had some information to back that up as well.
Yeah, no, I mean, I'll just say, that that research study was really quite novel, and I think is, hopefully just the beginning of us trying to uncover the population effects of wildfire smoke specifically. But I think these initial population-based data that Tom was referencing, I think are really in accordance with what some toxicology studies have been showing, back to 2009. I think I saw some early publications out of UC Davis showing that, pound for pound, wildfire smoke, much more toxic on the lungs compared to an equal weight of PM or particulate matter collected kind of, due to normal ambient pollution in the region. And so, this toxicology data in partnership with the population-based data, I think is really starting to provide an evidence base that wildfire smoke is really much more harmful than we thought initially.
Tim, if I could also just add to that, one of the things that we know very well now from wildfire smoke is it has immediate effects. That's really mostly what we've been seeing. But now we're getting to this situation where we have communities that are affected maybe for 1 or 2 months every summer. And what is the effect of those repeated exposures? We know from urban air pollution, from this fossil fuel combustion air pollution, that kind of pollution contributes to life shortening, progression of diseases, so it will accelerate sort of diseases of aging. And we're getting to the point now we're really starting to ask that same question about wildfire smoke, that's an issue that I never thought we would actually confront in my lifetime. But we're here in the sense that we have communities in many parts of the world that this is an annual thing for 1 or 2 months a year.
And Anna, I'm curious to get your thoughts from like the national perspective, and especially around that question, or any of the rest of you, of where does this fall on the spectrum of other health concerns or issues in North America or across the globe?
We have been looking at wildfire smoke more as a mixture of pollutants. Smoke contains numerous pollutants that are well recognized to be associated with health outcomes. Some of the health outcomes are very well studied, like respiratory and cardiovascular, but that is because the effects of air pollution has been studied in support or as an evidence for evaluation of what level of policies we should implement to protect public health, right? And these are kind of the outcomes that are most costly. Respiratory and cardiovascular outcomes probably together account for 3/4 of the mortality in the United States. But all the elements of the smoke which include particle pollution, ground ozone, carbon monoxide, aromatic compounds, nitrogen dioxide. They have all been associated with numerous health outcomes. Someone mentioned earlier fine particulate matter, which is like a fancy word for a particular size of the particles that are emitted during wildfire smoke. And these particles they pass deep into the lungs, and they cause inflammation, oxidative stress, and coagulation, which are all of the culprits to many health problems, and especially cardiovascular disease. But it's important to remember that these exposures are not associated solely with respiratory and cardiovascular events. There's numerous ways of the way smoke can impact us, including cognitive performance, trouble sleeping, eye, nose, and throat irritation. Those are all kinds of symptoms that may not need medical attention immediately, but they do reduce our productivity and increase discomfort, of course. So what I also want to add here is that while we may not know about many of the specific compounds during wildfire smoke and have not studied all of them, a lot of the evidence can be found in studies of air pollution, ambient air pollution. After all, as Marshall said, up to 50% of the, I believe you were talking about concentrations experienced in the Western United States now actually contain wildfire emitted particles. So differentiated toxicity of the particles in population is very difficult to do. And for that, we go to toxicological studies and controlled human exposure studies. But what's important to remember that we know a lot about air pollution and harmful health effects of air pollution. And that is the reason why we have a lot of laws and regulations in place in order to protect our health. With wildfires, it's a lot more difficult because we cannot regulate, and there's no simple or quick solution. The solutions are really complex and may take a long time. So in the meantime, we need to learn how to live healthy with smoke on a daily basis.
If I can add briefly to what Anna said there, I think it's a really important point she made about our regulatory apparatus, and I think we should really celebrate how successful our regulations, in particular the Clean Air Act, have been for other non-wildfire sources of pollutants. Concentrations of key air pollutants have fallen dramatically across the country over the last 3 or 4 decades, and again, that is a direct consequence of this successful bipartisan legislation. But as Anna mentioned, wildfires are not regulated under the Clean Air Act, right? They are exempt. They are considered acts of God, effectively. And so our regulation that has been so successful in improving air quality are not at the moment set up very well to regulate this new air pollutant. And that's going to be a real challenge.
Great, thank you. I like adding the positive aspects of this work too. Thank you. I think that really emphasizes how important this research is too. So transitioning to our third question is really an opportunity to learn all about your individual research. So you're all working to better understand both the short and long-term impacts of wildfire smoke on public health. Is it what you know already or don't know that most concerns you? And how might your specific work be helping the public make informed choices around exposure? I think I'll kick that off to Anna if you have more to add.
Well, okay, so as you know, air pollution is EPA's business. So we do study a lot about air pollution and wildfire smoke. And this research extends far beyond my research. But I can say it's quite extensive, but I can say roughly that it falls along three major lines. One is the research around air quality in general. That includes monitoring, modeling, and emissions. So people or my colleagues who are in this line of research, they will, for example, try to understand how measurement technology can improve representation of current or past air pollutions during wildfire or during post wildfires, during smoldering of the fires, or of ambient sources. So they also study how to inform public health communications with those new technologies, and how to help health research. The second area of research is health and ecological impacts. My research involves health generally. Here we know that wildfire smoke causes all kinds of effects, right? From scratchy throat and coughing and headaches to very serious impacts, including heart failure, cardiac arrest, and even death. And my research here focuses on learning how to incorporate living with smoke into our daily activities. And the second area of the research involves how to understand the trade-off between wildfire smoke exposure that we may expect and the management policies, such as like increased use of prescribed fire and the reduced risk of catastrophic wildfires, but then we are adding health burden due to smoke. So how to kind of understand what the trade-offs are. And finally, the third area of research is risk reduction. This is where we study exposure reduction, how effective they are, and public health messaging. Because after all, we have to speak at the multiple level. There's no simple solution. There's no single solution right now. So we have to make sure that various activities and recommendations that are coming out of the research are talked about, are clear and consistent across multiple levels of our society, including individual, interpersonal, organizational, community levels, as well as the highest level of the government, which includes policy levels.
Shanaz, I know you have some research going specifically on cancer research. Can you tell us a little bit about that and why you chose to focus on that?
Yeah, absolutely. Thanks, Tim. So yeah, to kind of build on what Anna was talking about, the sort of acute impact of wildfire smoke on human health, I think, has been receiving increasing attention. I think we know and are learning much more, particularly because of the close temporal proximity, right, that being exposed to wildfire smoke can have on those acute health outcomes. But we really know far less about the effect of wildfire smoke on chronic diseases like cancer. We do know that particulate matter, fine particulate matter in particular, does contain a range of carcinogenic compounds. These are your PAHs, benzene, formaldehyde, others. But the effects of these particulate matters and particularly wildfire smoke on cancer incidence, cancer mortality, cancer survivorship has really been unquantified to date. And like I said, this isn't really surprising. It is very challenging to study because not only do you have the issue of temporality where there's kind of this long latency or incubation period from the exposure to when a clinical diagnosis of cancer occurs. But then there's also, a lot of other exposures and outcomes that change over that period of time. So really kind of nailing down that causal link is a challenge. That said, as Anna pointed out earlier, there is a rich literature on outdoor air pollution and its effects on cancer risk and really, a lot of cancer outcomes. And there's a rich evidence base, and it's not that, I guess, not too far of a stretch to say that wildfire specific air pollution will probably have the same effect, if not even more severe effects for a number of reasons. So, for example, the International Agency for Research on Cancer, which puts out reports basically quantifying the research evidence for a number of carcinogens, whether they be biological or environmental. As early as 2013, recognized particulate matter as a carcinogen, as in its highest level of evidence. And really, the most strongest evidence is the link between air pollution and lung cancer. And lung cancer is not, not an insignificant issue. It's a pretty major public health issue globally. It represents the leading cause of cancer mortality around the world. And the increased risk that's thought to be associated with air pollution is about, somewhere between a 15 and 20% increase in risk due to air pollution. And that's once, other known causes of these cancers are controlled for, like cigarette smoking. But beyond lung cancer, I'd say that the evidence base is, less convincing at this point, given that we don't have a lot of data. So personally, the area of research that I'm prioritizing is trying to kind of expand on the scope of cancer to really consider potential wildfire effects across the cancer continuum. So this includes not just developing cancer, but what happens to people when they have cancer. Is this promoting poor survivorship or early mortality? And so we're taking a few approaches to address that research. Some of it is population-based, where we're linking statewide cancer registries to really, detailed air pollution databases that are quantifying wildfire-specific particulate matter and trying to understand, in high exposure areas, are we seeing higher diagnosis of more severe cancer, and among those people diagnosed, is there a survival effect? So this will help us answer questions like, does wildfire smoke exacerbate what we already know as toxic effects of cancer therapy, right? So there's pulmonary effects, there's cardiotoxic effects. Is wildfire smoke exacerbating those? And can we pull out those signals from the population data? And then we're also looking kind of at the molecular level, trying to understand, what changes are occurring to people with cancer in high wildfire exposure areas. We're specifically looking at epigenetic modifications like DNA methylation, which are known to be associated with cancer survivorship and particulate matter exposure.
Marshall, do you have anything to add? I'm really curious to hear what Stanford is prioritizing for your research.
Yeah, thanks, Tim. Your question was, are we more worried about what we don't know or what we do know? Classic academic answer is both. I think due to the great research that's happened among this crew and elsewhere, like we know so much now and way more about this than we did 5 or 10 years ago, and we know enough to be very concerned and to motivate substantial policy attention to this. To me, the critical things about what we don't know is, so exactly what does that mean? What do we do? So we know at a federal level, thinking in the U.S. again, our existing air quality legislation regulations are not well set up to deal with this new problem. So are we going to be able to deal with it sort of nationally at the regulatory level, or are we going to need new tools to deal with it? At a individual level, how do we think about dealing with it? How does wildfire smoke infiltrate into our homes or into our places of work? That's a topic that's gotten a lot of attention thanks to the recent existence and adoption of low-cost sensors that people put in their homes. We're learning a lot more about infiltration into home environments, but there's still so much we don't understand, right? It's something like maybe 10,000 people across the U.S. now have an indoor purple air monitor. For researchers like me, that's just been a gold mine in terms of understanding how wildfire smoke gets into people's homes and other pollutants get into people's homes. But again, that's just 10,000. It's a convenient sample. It's the people who are wealthy enough to have these monitors, right? And so, absent those data, we really don't have a comprehensive sense of whether people are able to self protect in their homes or whether we're going to need other investments, either in people's homes or larger public investments to help people be able to self protect in the context of these increasingly extreme wildfires that we're seeing.
I think Marshall really hit on a really important point there. So we're at a situation now where we're having to transition from this being this sort of acute thing where kind of our responses have been public service announcements, almost a waited out kind of approach. You know, you'll get through this. It's just a week. Hunker down. We protect the most vulnerable. Now we're talking, you know, tens of millions of people living with this day in, day out, and what are our strategies going to be? So we've done a lot of research on room air cleaners. We know they work, but the challenge is how do we scale that up to the whole population? We went through the same kind of thing with air conditioning. It probably has taken us 50 to 60 years to sort of implement that for all segments of the population. Are we going to do that for air cleaners? We don't really have a lot of easy regulatory mechanisms to deal with wildfires. We can do better with forest management, certainly, but we're going to have this smoke, and how do we protect people? And that's really our challenge for the future. And I am optimistic though that we can do it. We have integrated sensors in many of our buildings now, so we're trying to do some studies of that. Can we turn on filtration? Can we adjust how we operate our buildings, where people are spending time? In the future, I think moving forward, we're also going to have to think about how do we actually schedule our lives. So I've had conversations, with baseball teams, like, what about the baseball season? What do we do when we got 40,000 people in a stadium? When there's a smoke event, and I think again there are ways to deal with that, but we're going to have those conversations.
I think what's the scariest thing to me is not so much what we know or don't know, because we know a lot, but are we ready to do something as individuals? Are we ready to change our lives, to accept the message in face of a lot of uncertainty? And we've gone just through a very difficult period of pandemic, so we know how difficult it is for us to change our behaviors and adopt recommendations. And in this case, it's even less clear because there is no single solution for everyone. So it has to be a combination, something that works as a new lifestyle. Same way that we think of the weather, you may be like me and never take the umbrella, but I live in North Carolina. But it's something that we need to, adopt into our lives and work with it. How to stay healthy while there's smoke outside. Maybe change the air conditioning systems, support population in different ways. I'm sure the economist will have very good suggestions for that.
To what extent do you think we've inadvertently benefited from COVID? I mean, COVID has obviously been terrible, but the attention to indoor air quality and filtration is much higher, and even masking to some extent, although I think there's still some basic scientific questions about the benefits of masking during wildfire smoke and to whom, right, who it helps. But is COVID in some sense a dry run for a lot of what we're going to face with wildfire smoke or already facing? And have we seen inadvertent benefits from that dry run?
I think it's challenging. So we saw situations, for example, during COVID, where we had schools where, on the one hand, we were telling classrooms to sort of meet outside, but then we'd have a smoke event, and there was nowhere to go. One thing COVID's certainly done is it's raised the profile of ventilation, which is great, I think, in general as sort of a public health measure. Filtration with ventilation could be effective with smoke, but I think the biggest thing is actually masking. Masks were always something that we knew could be effective for wildfire smoke, but we were never recommending them for the general public, just because who's going to do this? Who's going to wear a mask 24/7? And I don't think we will get the whole population ever to wear masks 24/7, but we certainly have gotten a lot of practice. over the last few years in how to wear masks and when to wear masks. And I think now that should be part of our approach, combined with things like filtration and better ventilation indoors. So I think that that's been a really great learning experience. And we have also learned, how far we can push things in terms of masks. That I don't think, we're going to get to requiring masks for the whole population. The kind of mask mandates, are over. And we also see negative impacts, in terms of mental health and learning for masks. So how do masks actually fit in the conversation? I think we've learned a lot about it.
Masks have, as Michael said, it's have always been a hard issue, hard to sell public health recommendation, and on one side, the positive thing was that we are a lot more aware of our environment. What worries me with masks is that wildfires have a lot of volatile organics and gases. Masks are not gonna, well, I shouldn't say they're not gonna protect us, but we don't know to what extent they would protect us from volatile organics. And thermal exposure, in occupational exposures and in the exposures of the wildfire firefighters in the urban environments, we know that they're completely covered, and only small pieces of their skin are showing, but thermal exposure accounts for a lot of their exposure and mutagenicity of smoke.
If I could jump in, a number of mitigation options have been mentioned. The single room air purifiers, for example, or improving HVAC systems to put in a better filtration system for one's home, or even wearing masks. And I think we have a lot of, as people have said, we've got a lot of practice now with wearing masks. And some questions remain as to how much protection they provide, but we've certainly developed the distribution systems. But I think for a lot of people, it's expensive. If you're thinking about replacing a mask daily for your whole family, or if you're thinking about upgrading your HVAC system, or buying an air purifier for your home, I think we need to be thinking as a society, what policy steps can we take? Is there a way that we can provide incentives, financial incentives or subsidies, at least targeted to those who are at the greatest risk? So I think these are some questions that we need to be thinking about.
All right, well, let's move on to the next question, which some of you have already touched on, but I'm curious, in your individual research, what are you seeing as who in our communities are the most vulnerable and bear the highest burden, and what would be the cost of not doing anything to support these folks further?
Yeah, I think our understanding of who's vulnerable to wildfire smoke exposure, and here again, best measured is the ambient exposure. I think our understanding of who's vulnerable has really expanded recently, and thanks again to a lot of the research folks here have done and elsewhere. Uh, Pretty much everywhere you look, various health outcomes, cognitive outcomes, you see impacts of wildfire smoke exposure. Many of these studies are just getting done now, and so I think the evidence base again is building pretty quickly. Uh, but just thinking of our own work, we see pretty substantial effects on uh, preterm birth in California. So a very important health outcome. Again, in the broader air pollution literature, these links have been known for a while. We see it very clearly in the wildfire smoke as well. And so this means pregnant people anywhere should be considered a vulnerable community, right? And that is a huge number of people. Um, on the cognitive side, we just published a paper that showed substantial negative effects on test scores of wildfire smoke exposure during the year. That could be on the day of the test or throughout the year in a way that inhibits learning leading up to the test. So that means every school kid who's exposed to wildfire smoke should be considered vulnerable, right? This is hurting their learning. So that's a huge population. So we need to figure out. We need to number one expand our notion of who's vulnerable, and then I think as folks mentioned, really think about how we protect them where they are, and that's not something I think the data show that we're doing very well right now.
And Tim, let's not leave out, what we already know, which is, the older members of society and people with pre-existing diseases. So that's really the first people who get affected by even a short episode, and that's very consistent with what we see from urban air pollution, and then also, even younger people with pre-existing respiratory disease, so asthmatics, for example, really get affected very acutely. Those, I think, are actually situations where we know how to deal with even medically. So one of the things that we've been actually doing in this part of the world for a number of years is making sure that before the wildfire season starts, individuals with pre-existing diseases have a conversation with their healthcare provider, making sure their disease is well managed, making sure there's enough medication. We see during fire and smoke events that there's a run on pharmacies. So you can't refill a prescription. So people have that in advance and they're ready, they're all prepared. They're aware of the public service announcements. You can actually minimize the effects on those individuals as well. So there's a medical response component that I think we need to also think about and bring in here.
Yeah, I meant, thanks, Michael. I meant my comments in addition to all the sort of main health impacts. I think that you outlined really nicely at the top of the hour here. My point was that we're learning that they go way beyond sort of what we thought were the only or the key ones.
If I could just add here as well, I mean, I think, as we think about health outcomes of wildfires, certainly some things we're seeing signals of in our data up here in our UC Davis catchment area, and things that we're very concerned about is that the wildfires could exacerbate what we already know of as existing social and economic inequities that put vulnerable populations at higher health risks. So, in these different types of vulnerabilities, I think can manifest with acute fire events, and then there's some that are, can have more long-term effects. And so I think to me what this really kind of emphasizes is that, as we think about sort of resilience, we should really be thinking about equitable resilience and addressing these social determinants of health that we already know exist and put certain communities at disadvantage for health outcomes, that we really kind of prioritize this as we conduct future research and interventions to mitigate effects of wildfire smoke. I know that Marshall was and Michael were talking about, of course we know filtration and all of this is fantastic and very helpful. And it's quite interesting because those purple air sensors that are, now ubiquitous in certain households give us some information on a slice of the population, right? And in fact, what they're telling us is people that have indoor monitors in their house actually behave differently during a wildfire event. They're able to seal off their house, probably turn air conditioners on. And the research is showing that actually their particulate matters are lower than during non-wildfire events because, they're aware and able to make changes. Yeah. So anyway, I think we just have to keep in mind that that's a slice of the population, but may not represent our most vulnerable.
That's so interesting. Thank you. I didn't realize that.
I don't know, Marshall, if you saw that paper. I think it was a PNAS paper last year. It was really kind of interesting.
Yeah, thanks, Shanaz. I did. So we estimated that in our own data as well, and actually did not find that. So we found that people were not differentially aware that wildfire smoke was bad. Certainly, on bad days of any sort of bad air quality, when it's very apparent outside, you do see behavioral changes and less infiltration. But we actually did not find that that people were more responsive to wildfires than other air pollution sources. So maybe an unresolved academic debate.
And so that question around cost of inaction, of not doing anything more, I mean, it seems like it's such a massive issue, it's hard to even try to quantify it. But it seems like all these other health issues could continue, and people could assume that they're from other underlying issues. And we would, if we didn't continue to research this issue, we just wouldn't really understand the impact from wildfire smoke alone, right? I mean, would anybody add to that? Does that resonate?
Well, I think, over the years, what's striking to me is just how much things have changed in the last decade. If you look at just the cost of uh, property damaged and suppression, it used to be on the order of $1 billion a year, but the last 5 years or so, it's jumped up to $10 billion a year. And there's a lot of research that's come out recently that suggests that, beyond the direct costs, the health impacts are probably the same order of magnitude. So these are pretty significant numbers. And so when you think about what the costs of action are relative to the cost of inaction, I think it's a really good investment for us to be taking this very seriously, and for us to be investing in ways to protect people, especially those who are most vulnerable.
I think that now circles back to Marshall's question of the regulations may not help with smoke exposure, but the same way that regulations are supported with the data or evaluated on their cost benefit analysis is the same way you would evaluate how much do we need to invest, or how much is worth investing. What is the cost of inaction, I guess.
And another sort of related issue, it's probably less relevant, for many parts of the US, but certainly is very important for other parts of the world, is because we're going to be having this increased level of wildfire smoke exposure, it's even more important to actually deal with the other sources of air pollution that we know how to control. And that's very efficient to do. So we know actually how to manage that. We know that when we manage it, we can do it cost effectively, and we reduce health impacts. So, I even have those conversations in North America. This actually, the fact that we're dealing with this challenge, that is a really tough one, because we can't really apply a lot of regulations, but it does mean we should be really vigilant in the regulations that we have for fossil fuel combustion, air pollution, all those other sources. Anything that we can do to sort of lower that, that's going to benefit. And on sort of a related note, anything that we can do as a society to improve the overall health of our population will also minimize the health impacts from wildfire smoke. So all of those other things, diet, smoking, alcohol, getting enough sleep, exercise, all of those are things that both as individuals, but also societies, we can do that will actually have impacts and benefits.
I did want to build a little bit on what Michael was saying with, building up our systems. When we talk about health, there are a lot of preventative things that, regardless of a wildfire, we could help to build up, right? To make sure that all of our communities are getting access to the right types of surveillance and screenings, so that, that the impact of having a major life disruption due to wildfire isn't going to have as detrimental of an effect on health if people are kind of generally up to date in their preventative care.
Great, thanks, and that's all a good segue to my next question. And it's trying to put more of a positive light again on all of your research and how it might help people make more informed choices on their own, which I think is so much really at the core of this issue. And I was just going to share a little story that one of my closest friends is an elementary school teacher here in Portland. And it was, I think, mid-October that Portland had its worst air quality from wildfire smoke this year. And my friend shared with me that the principal of his school asked all the kids to stay inside. I think it was for a few days. And I thought it was really interesting. The principal supposedly got as many positive comments from parents thanking them for keeping their students inside or their kids inside, versus the number of negative complaints that they got from parents saying that their kid wasn't allowed to go out and exercise during recess. So there's so many scenarios like that, right? And I think that's where there's a lot of really interesting overlap with COVID too, that we have to weigh so many different variables. And how do we empower the public to do that on their own, especially when they're making choices for a number of other people, like in this story or this example? So I was wondering, what are all of you working on, or the tools that are already out there that help people make informed choices?
So we do have information, as others have mentioned, from outdoor air pollution, that fossil fuel sort of air pollution, that I think in those kind of scenarios gives us a lot of guidance. So we've done studies both at population levels and also in controlled exposures, where we actually put people in a facility and see how they respond. We've done that with athletes as well. And we know that like these short-term exposures, you get a decrease in performance. There is sort of an immediate effect, but it's mostly reversible. So that tells us that, in a short-term kind of situation like that, yeah, those kids probably, if they were exercising outdoors, the benefits of the exercise would probably be canceled out by the negative impacts of the smoke. So if it is a short event, it's best to just wait it out. There's probably not a lot of long-term harm from 1 or 2 days of exercising outside, but you're really not getting the benefits that you think you're getting. I think the challenge is, again, what if it's a month or 2 months? And we do have some parts of the world where the air is so polluted that, a wealthy school will actually have kids exercise in an indoor bubble. I don't know if we want to go there, and hopefully we won't. But I think there's other approaches that we can take just with scheduling. And we might want to think about, even during a smoke event, times of the day. And certainly, varies from day to day. And we have a lot of that information. We have smoke forecasts that are regularly available now. They're improving in accuracy, and I think it's really just a matter of getting a lot of that information into our daily lives, especially during the fire season.
And I know you've launched an app that kind of empowers people from a citizen science perspective. Is that right?
Yes. So we've been trying to learn how to elevate health risk communication in the way that motivates behavioral change in the context of wildfire smoke exposure. Because we realized, traveling into the communities and in the meetings, we realized there's this gap between everything that we know as a scientific community, and even what we know about reducing exposures and potentially improving public health, and what actually happens in real life, right? So to do so, we really felt we needed to understand how people perceive the issue, what their motivations are, and what are the barriers to actions. So we launched this citizen science project, which had both investigative and educational objective, to maintain and develop a platform for building the knowledge about how people interact with this issue and support development of successful public health campaign. Right. So what we do is people at this currently people interact with the smartphone application that provides them a lot of resources about where the fire is, what's the air quality, where is the smoke, what can you expect, learn how to protect your health, see what other people are reporting, report your own experiences of smoke and health symptoms, as well as behaviors. And we learned a lot from there. In the next fire season, we're going to launch a new SmokeSense version of SmokeSense, which is called SmokeSense Leveled Up, which we actually implement a lot of the concepts of behavioral sciences and social sciences that we think will enable us to talk more effectively about air quality. But I just want to mention, how one of the striking lessons that we learned during our experiences with SmokeSense is actually how difficult it is to talk about air quality. We all care for air quality, but we don't have enough space necessarily in our lives to develop new habits that are around us. So when we say, yes, you should talk to your doctor, but how many of us do actually talk to our doctors about health impacts? Actually, my very close colleague who works very closely with wildfire smoke he was in California, and what happened? Well, he has to get his morning run in, and it was very, very smoky. So even he himself had a hard time living, um, adapting to that condition. And we find that like message, there's no silver bullet. The messages that we provide don't there's no single solution, right? Like in a case of a tornado, go in the shelter. There's no single message that we can give people to understand and modify their behaviors. So in the absence of clear message, what we see is diluted messages, right? And these, when message is diluted and the perceptions of risk are low, together they don't sum up to enough of evidence to us that overcomes the barriers that we have to adopting new behaviors surrounding, or the cost of action is what we refer to it, in order to adopt those new behaviors. So we hope that we can borrow some ideas from health behaviors that can help us talk constructively and incorporate air quality into our daily lives.
I'm curious, Anna, because we talked a little bit about, kind of the convergence of multiple public health crises, right? Where we have COVID and getting the message of, be outdoors, be in well ventilated spaces, social distance, obviously, but then in the crises of wildfires, we often get messages that are different. So I'm curious if your data collection with your app kind of spans pre-COVID and COVID time periods, and if you can kind of discern behavior changes that kind of resulted from the two public health crises coming together at the same time. So are people behaving differently, in the face of COVID than they would have without COVID?
Yes, we do see, people are more likely to wear a mask and more likely to be prepared as the time goes on, right? Because they have experienced smoke in previous seasons. But it's a selected sample, right? We have about 50 something thousand users, but they're largely people who are very motivated to learn about air quality. But still, they provide enough information to us, about general state of how people are perceiving the information and receiving the information, in order to construct a level of engagement that would help us move on the decision process as individuals, from the state of I don't have to do anything, I'm in denial, to yes, this is an issue that I can easily overcome. I just need to take my umbrella, with the caveat that there is no umbrella in the sense of smoke, right? As it is in the weather.
Well, thanks. I think for the sake of time, we need to move on to our last question. And it's really just what do we need to do to elevate this issue within the research and public policy spheres? You're all doing such amazing research. And do you see any kind of strategies or opportunities that we can utilize this research to create more change on the ground?
I think we've seen a lot of increased attention to this issue. I think in large part because there has been so much high quality research showing that the risk of wildfire smoke is dramatically expanding and that it negatively affects things we care about in the world. So the thing that keeps me optimistic is actually seeing the policy engagement, seeing the private sector engagement on this issue, right? In thinking about how to lessen and mitigate risks. At a broad scale, I think the our ambition should be shaped by the impact, right? And as we learn more about, and that's where I think again more research on this can be helpful. It can shape the level of our ambition, And frankly, our ambition should be a lot larger than it is. We are moving in the right direction in terms of making the right investments, either to help individuals limit their exposures or to think about large scale investments in forests to reduce the risks. But we need to do a lot more, and we need to scale these up. I think the research would suggest to a much higher level than what we've seen so far. So I'm optimistic in terms of the direction. I'm hoping it can accelerate.
Tim, I just wanted to jump in and just thank everybody. When I chaired the mitigation committee for the Oregon Wildfire Council, and we were trying to prioritize where we would take action in order to reduce health risk, we found that we just couldn't find the data. There was no sort of spatial understanding about A, what the impact was, or B, what would be the benefits, so therefore the cost benefit analysis of taking action and managing forests. And so your work, I can only imagine, maybe you don't feel this way, but I imagine this has been a lot of work with not a lot of attention for a number of years. Now we're getting more attention. And I think we're really sort of hoping that this issue will be elevated to a level equal to many other public health issues with the appropriate level of funding and attention and hopefully action. So thank you so much.
Yeah, thank you again. And we encourage our viewers to tune into part 2 of our program, where we're going to discuss additional strategies that we can take to create community resilience to wildfire smoke. So thank you again, and we hope to see you soon.